Over 33 million people on the planet are infected with HIV. Here in Manitoba, cases continue to climb, leaving us with one of the highest per capita HIV rates in the country. But this global epidemic has hit hardest in sub-Saharan Africa, and in countries like Kenya, AIDS remains the leading cause of death. In 1980, when knowledge about HIV and AIDS was still in its infancy, a senior infectious disease fellow by the name of Frank Plummer went to Kenya for a year to study genital ulcer disease. Dr. Alan Ronald, who helped establish one of the first HIV/AIDS investigation clinics in Africa, remembers those early days.
I was trying to get a program started in Nairobi. It was very early days. We didn't have any money and we had very little support systems. And Frank and Carla were vulnerable to being asked to go on this exotic safari to Nairobi. And my idea was that they'd continue the studies that we were doing, trying to understand why so many people in Kenya, particularly the men, had ugly infections of their genitalia. Following from this was his studies of sex workers and how they respond differently when they're exposed to HIV. And some get infected, some don't. Some get infected and they die very quickly. Some live like most of us here do for a long time. And these are all very important initial observations that Frank now has built a huge research program around, trying to understand how do some individuals get exposed to HIV, but they don't get infected.
For the next 17 years, Nairobi was home to Dr. Plummer and his family. His work there has led him to become recognized as a global leader in the search to find a way to stop the spread of HIV. Frank Plummer was born and raised in Winnipeg, Manitoba, and received his medical degree from the University of Manitoba. He trained in internal medicine and infectious diseases at the U of M, as well as the University of Southern California, the University of Nairobi, and the U.S. Centers for Disease Control in Atlanta. In 1984, Dr. Plummer joined the University of Manitoba faculty, where he is currently a distinguished professor in medical microbiology and community health sciences.
I was approaching the end of my PhD here in the Level 4 program at the National Microbiology Laboratory, and I asked Frank Plummer if he would mind sitting with me and talking with me a little bit about some of my future prospects in research. So he made the time to sit with me and talk about what my interests were, and he told me a little bit more about what his lab was doing and the directions he would like to see it go in. And he offered me a postdoctoral fellowship position, which I happily accepted and have enjoyed very much working with him and his group.
Dr. Plummer's credo: to appreciate science, you have to do it. The process of discovering something new is wonderful and exciting, and unless you do it, you can't understand it. Dr. Plummer has lived this belief at every step in his career. He has been an advisor and a consultant in demand by international organizations, including the National Academy of Sciences in the U.S., the World Bank, the World Health Organization, and the governments of Lesotho, Kenya, and India. Today, Dr. Plummer is the Chief Scientific Advisor of the Public Health Agency of Canada and Scientific Director General of the National Microbiology Laboratory in Winnipeg. As Scientific Director, Dr. Plummer is in charge of Canada's only Containment Level 4 lab. The lab is a leader in research for several major diseases and was thrust onto the world stage in 2003 when the SARS outbreak hit. Public health researchers around the world work to understand it. It's a time Dr. Plummer described as doing science under intense public scrutiny.
It was a frightening time. We were receiving samples day and night from patients, and we didn't know what we were dealing with. We just knew that it was a very grave situation. Frank Plummer did an incredible job of coordinating the efforts and really identifying what this was that we were dealing with.
The National Microbiology Laboratory made significant contributions to the identification and control of SARS, and Dr. Plummer's actions during the crisis further defined him as a leader. But Dr. Plummer's primary mission remains to stop the spread of HIV and contribute to the development of a vaccine that could save millions of lives around the world. The collaboration that began in Kenya in the 80s continues to flourish, and has produced groundbreaking results. Not only have hundreds of scientific papers advanced the research, the project has also brought critical resources to the effort. Many discoveries made through Dr. Plummer's research have been put into practice. He has developed low-cost educational and practical interventions that are saving lives around the globe. Support for Dr. Plummer's research has come from many fronts over the years. Since 2001, Dr. Plummer has held a Tier 1 Canada Research Chair from the Canadian Institute of Health Research. In 2005, he received a grant from the Bill and Melinda Gates Foundation's Grand Challenges in Global Health Initiatives to continue studies on HIV resistance and work on an HIV vaccine. Your contributions will help advance the battle against HIV/AIDS, as well as the West Nile virus, influenza, and tuberculosis. They will also be used to accelerate collaboration between the infectious diseases community in Winnipeg and the new Hebrew University Institute for Medical Research in Jerusalem.
I think it's going to be very exciting to see what kind of information we glean from this experience. There's so much technical expertise on both sides, and I think it'll be wonderful.
Dr. Plummer recently visited with Dr. Eitan Yefimov, Director of the Institute for Medical Research, to discuss their upcoming collaborative research projects. They are convinced that this sharing of knowledge will make great headway in their research.
There is always a deficiency in the understanding of how basic data can be translated into an effective clinically significant modality. And this deficiency should be filled up by collaborative approaches, where each scientist on each side of the ocean contributes to the understanding of the same particular disease. And I think that through such a collaboration, we may be able to come up with a new idea and a new approach as to how to cope with those diseases which, to the best of my knowledge, are incurable at this day.
Dr. Plummer has received many honors and awards over the years. Most recently, he was awarded the CIHR Michael Smith Prize in Health Research, elected as a Fellow of the Canadian Academy of Health Sciences, and appointed an Officer of the Order of Canada. If you ask him what's most important in his life, he would most likely tell you it's the strong family bond he shares with his wife Carla and their 3 daughters, Marielle, Jamie, and Danica. Tonight, the Canadian Friends of the Hebrew University of Jerusalem Winnipeg chapter celebrate Dr. Frank Plummer's continued commitment and excellence in medical research and are proud to present him with the Scopus Award.